Good morning, what's on my mind? I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, the topic of the day is cirrhosis. Change gears a little. We're not going to talk about medications this morning, but we'll be talking about cirrhosis because I think with the rampant use of alcohol in Dominica, there has to be concern for the long-term complications such as cirrhosis. So what is cirrhosis? Cirrhosis is a chronic and progressive disease that takes healthy liver tissue and replaces it with scar tissue. We call that fibrosis, right? And if you're replacing normal tissue with scar tissue, then you have a decline in the liver function. And the liver is very, very important. It's essential for detoxifying your blood, all right? So all the blood from your gut and everywhere else goes through the liver before it gets rerouted back to the heart, right? It also produces bile for digestion, and it stores very important nutrients and very, very important in the metabolizing of medications. So a lot of the medicines we take is metabolized by the liver. And as you get cirrhosis and it worsens, these conditions become affected, right? And you have life-threatening complications, okay? All the factors that causes your blood to clot comes from the liver, right? So as the cirrhosis gets worse, you can actually bleed out, right? So, and again, remember, cirrhosis doesn't happen overnight, right? It's the end result of long-term repeated liver damage. And the most common cause is chronic alcohol use, okay? Heavy drinking over several years is one of the leading causes of cirrhosis. And what alcohol does, it inflames and damages the liver cells, the hepatocytes. And that leads to scarring, and obviously you get worsening disease into cirrhosis and different stages of cirrhosis, all right? You know, viral hepatitis, hepatitis B and hepatitis C. Let me take a sip of my coffee. Right, you've heard of NASH or non-alcoholic steatohepatitis, right, with the liver, fatty liver disease, right? It's associated with obesity. So if you have morbid obesity, you can get cirrhosis from that, all right? High cholesterol, all these things, all right? There is also a condition called hemochromatosis where you have, it's autoimmune, right? You have iron overload within the system. You have Wilson's disease, which is accumulation of copper. So there's a lot of other things that can cause the cirrhosis. But the focus here is the alcohol consumption, the uncontrolled alcohol consumption that we see in our population, all right? And this goes undiagnosed, okay? When you have end-stage cirrhosis, you have the yellowing of the eyes and several other things. But I want to talk a little bit about the drugs that can worsen your cirrhosis, right? Hepatotoxic drugs. And I talked about one before, paracetamol, which is Tylenol, which is acetaminophen, right? In the low doses, it's okay. But if you have liver failure, that is a problem, and stay away from it. Okay, there are other drugs, including the statins that we take to lower cholesterol. That in some people can cause, and there's a few other medications that's not popular, like methotrexate, that's used in autoimmune disease and things like that. All that thing can exacerbate, but different lecture in of itself. What I want to emphasize here is herbal supplements. Herbal supplements can also, people say, oh, I'm taking herbs and things like that. There are some herbal supplements, if you have liver disease and if you have cirrhosis, that can exacerbate it. If you heard of kava, even a large amount of green tea extract, okay, do your research, do your reading. These things can worsen, right? Now remember that cirrhosis cannot be cured, okay? It's irreversible damage to your liver, so you have to pay attention to that, all right? A lot of patients take the diuretics that I talked about, the Lasix, the spironolactone. That helps manage the fluid overload and the fluid that accumulates in your belly. There's a medication called lactulose that we use up here that reduces ammonia buildup, because ammonia builds up and then it fogs your memory, encephalopathy. Right? There are just so many other medications that we can talk about, but I want folks to read up on cirrhosis, because the amount of drinking I'm seeing, I said, wow, what's going to happen 10, 15 years from there for those patients, right? It's once you get to the point of decompensated cirrhosis, there's different classifications. I won't get into it. The liver can no longer perform its vital functions, all right? And you have buildup of fluid in your belly. You have bleeding varicose veins around your esophagus, so you can start throwing up blood. You turn yellow, your eyes turns yellow, and you get confused from the buildup of ammonia. All right. So again, pay attention. It's a horrible disease once you get to cirrhosis. All right. And again, I always tell patients, if you have cirrhosis and it gets to the point where you decompensate, where you're having problems, you have 2 to 5 years prognosis. All right. And just pay attention to these things, guys. I'm not saying don't go out and have a social drink, but you cannot be drinking every day of the week. You cannot be drinking every weekend. You need some significant lifestyle changes, and monitor yourself. All right. And be our keeper. Educate each other. And if you see wrong, say it's wrong. Okay? I just want to give a short spiel on cirrhosis and alcohol consumption. There's also something I will eventually talk about too, which is called alcohol fetal syndrome, where people who drink large amounts of alcohol, it affects the uterus. I mean, the fetus in utero. Okay? There's a lot of things that we can educate ourselves on to be better. Have a great day. I'm Dr. Dangleben on behalf of Patient Choice. Peace.